That's amazing. It's another incentive for members to go and really look into their health, to find out what's going on with their labs and their levels, and having all that information ready for a primary care physician.
Right.
So what about surgical services?
This is an interesting category or topic area to talk about. For a long time, most outpatient surgical procedures were done at outpatient hospitals. And we've talked in the past in different settings that receiving care at an outpatient hospital is generally one of the most expensive sites of care that a member can use for whatever care that they need. Surgery is no exception to that. The other thing that's interesting about surgery is that the cost varies widely from provider to provider, even hospital to hospital. There's no rhyme or reason why these costs vary so significantly. So a number of years ago, we partnered with Carrum Health, who is what's known as a surgical centers of excellence provider. And Carrum goes out and contracts with ambulatory surgery centers, and in some cases, outpatient hospitals, and the best of the best surgeons throughout the state of California and throughout the rest of the country, and have curated this network of top-tier surgical centers of excellence and physicians to provide surgical care for our members. So if you need a knee replacement, Ron, and you happen to live in rural Northern California, do you want to go to the guy who does 5 of these a year? Or do you want to go to a surgical center of excellence that does thousands of them a year? Where do you think you'd want to go?
I want to go to the best.
You want to go to the folks that do this day in and day out all day long, right? And that's what Carrum offers to our members. And this is a voluntary program. We don't force our members to use Carrum for surgical benefits, but we also seek to incentivize our members by eliminating member cost share. So co-payments, deductibles, co-insurance, we waive those to incentivize members to use Carrum surgeons and centers of excellence for their surgical needs.
So that term keeps on coming up, Jeff. Tell me about a center of excellence. What makes a center of excellence?
So a center of excellence really comes down to 2 components. Number one is volume. Is a surgeon or is a facility at the surgery center or hospital doing a significant number of these procedures a year? But more importantly, what are their outcomes? What are their complication rates? What are their readmission rates? What are their revision rates? Right? So Carrum only contracts with the best of the best, the elite in the state of California and throughout the country. And they reevaluate and recontract those folks every year to make sure that they meet the standard that Carrum has set for quality and outcomes delivery.
So the doctors know what they're charging, which means the members know what they're paying, and there's no surprise billing?
No surprise billing. No.
Is surgery the only thing that Carrum does?
It's not. We've expanded our offerings through Carrum. We offer a few additional services now, one of which is cancer guidance, and for certain types of cancer care, so radiation and surgical excision. Cancer prevalence is growing. Cancer is a complicated disease state, and what Carrum's done is curated a network of the top tier cancer centers throughout the country that can provide peer-to-peer guidance. So if you're up in rural Northern California, up in Lake County, and you've been diagnosed with cancer and you're seeing a local treating oncologist in that area, you can have that oncologist connect with a Carrum contracted oncologist, perhaps at City of Hope or at Memorial Sloan Kettering, and have a consultation about your cancer and your treatment plan, and get a peer-to-peer review and maybe some suggestions of how to tweak that treatment plan. And in some cases, you might need a surgical excision or radiation for certain types of cancer. And so Carrum provides those sorts of resources for the cancers that they treat at the various surgical centers of excellence that they've contracted with. And again, we waive member cost share for folks in those situations as well to incentivize them to use Carrum for that care. And then the third area that we've expanded with Carrum is the area of substance use disorder. This is also an area where it can be really difficult to find an in-network provider for someone who needs either extensive outpatient therapy, or in some cases, they need intensive inpatient care. It can be really difficult to find a provider. Carrum, like with surgery and with cancer, has curated a network of behavioral health providers that are available to our members who may be in need of substance use care for alcohol or narcotics use disorders. And again, we waive member cost share. We make it easy for members to get access, and they get access generally quicker than if they were to work through their health plan directly.